Hello, Bridget.
Hi.
My name's Annie Phillips. I'm going to be the RN today for Dr. Smith.
Okay.
Do you know why you're here today?
Yes, just a routine checkup, a physical assessment.
Oh, okay, great. So I'll be the person performing that head-to-toe assessment.
Okay.
Is that okay with you?
Yeah, that's fine.
All right. I will shut the door here to provide privacy, and then I'm going to go wash my hands.
Okay.
For infection control. I noticed when Bridget walked in, her gait was steady, nothing abnormal there. She's able to have a conversation. She is alert to situation and to person, to place. Okay, Bridget, the first thing I'm going to do is check your vital signs.
Okay.
That involves just taking your blood pressure and your pulse. Can I use either arm for your blood pressure?
Yes, that's fine.
All right. Your blood pressure is 124/84.
Okay.
And just so you know, hypertension is considered a blood pressure of 140/90, but the new guidelines do consider pre-hypertension of a systolic or top number over 120 and a bottom number of over 80.
Okay.
So I don't want you to get too worried right now, but it is something that we will continue to monitor.
Okay, that sounds fine.
Next, I will check your pulse. While I'm doing this, I'm also counting her respiratory rate. Okay, her pulse is 64 and her respiratory rate is 20. And those are both within normal range.
Great.
Okay. Are you having any pain right now, Bridget?
No, I'm not.
Okay. On your first visit, we like to establish a comfort goal to use in the future.
Okay.
We use a pain scale here of 0 to 10. 0 means absolutely no pain, and 10 would be something excruciating. So like you just told me you didn't have any pain, so I rate that as a 0.
Mm-hmm.
Where would you rate your comfort goal?
I would say about a 4.
A 4?
Yeah.
Okay, yeah, that sounds good. Let me jot that down here. Okay. Next, I'm going to start the head-to-toe assessment with your scalp.
Okay.
Okay. Let me know if you are having any pain or discomfort. Okay. Scalp feels normal shape. You know, I don't see any scabs or wounds, lacerations, anything to the head. Let's see. Oh, the hair is shiny and healthy looking. It's not too thin where you would worry about like thyroid disease or anything like that. Next, I'm going to move on to your ears. Let me grab my pen light here. And again, tell me if this hurts or any discomfort.
Okay.
Bend the pinna down and it goes back into place very easily. I'm looking for drainage, redness. I see, everything looks normal there. I'll do the same on this side. No pain with that?
Correct, no pain.
Okay. No drainage or discharge. Any trouble with your hearing you've experienced lately?
No, nothing.
No? Okay, if she would tell me that she was having trouble with her hearing, I might do like a whisper test, or taking my watch, if you have a watch, with the little clicks, holding that up and seeing if she's able to hear that. And that will tell us if further testing needs to be done. Next, I'm going to move on to your nose. You've never had your nose broken or anything?
No.
Okay, good. And it looks midline and symmetrical and no trouble breathing?
No trouble.
Okay, I'm going to check for patency of the nares and just hold one side. Yes, good. And the next. Good. And then I'm going to look up the nose and I see no redness, no drainage. next I'm going to go to your eyes. I'm going to check for direct pupillary response. So all you need to do is just look straight ahead, okay? And I'm going to shine this light in your eyes here. Very good. It goes about a 3+ to 4+. Same there. And now I'm going to check for that indirect response. So I'm just going to do one eye at a time and see if the other one responds. And your eyes both do. So that's normal. That's what we like to see. If you could just follow this pen light.
Okay.
I'm going to bring it to your nose. Just follow it. Okay, great. And eyes crossed and pupils constricted, so that's a normal response to that. Next, I'll check your 6 areas of gaze.
Okay.
And so all you really need to do is follow this pen light, okay? Just don't move your face or head, just move your eyes. Okay. Slow down a little bit, but and I didn't see any strabismus or do they when the eye kind of flutters, nystagmus. So you had a normal response to that, okay? Let's see. I did not check your mouth yet.
Okay.
So if you could just open your mouth. I'm looking for lesions. Any sores in the mouth, any thrush on the tongue. Her mouth is moist, it's pink. If you want to say and the uvula lifts up. If you want to lift up your tongue, we'll look under for any sores. And nope, that looks good. Can I see your gums? Gums are healthy. Smile was equal, symmetrical. Any pain with the jaw?
No.
Okay, you want to swallow for me? Any pain when you swallow?
No pain.
Any problem with your thyroid that you know of?
Not that I'm aware of.
Okay, great. I would also like you to just lift up on your shoulders, just kind of shrug your shoulders for me. Oh, good. And you had good resistance to my arms, and that's what we're looking for. If you could just squeeze both my hands, that's equal, symmetrical. You've got great grip strength. That's good. You can you push up against my hand? Okay, perfect. Really good. Next, I'm going to check your skin over. I'm looking for any macules, papules, ecchymosis, bruising, any kind of open areas or anything. And your skin looks really good. It looks, moist and pink. I'm going to pinch your skin here just to check turgor, to check your hydration status. And your skin immediately responds. That's a good, response there. And checking capillary refill, when I push down on the finger bed there, the nail bed, it should immediately, we're within 2 to 3 seconds, return to its normal color, and yours does do that. So that's all very good. Next, I'd like to listen to your heart, if that's okay.
Yes.
I'm going to start with the aortic valve. There's 5 valves in the heart. I'm going to go on to the pulmonic, then Erb's point, tricuspid, and mitral. I will listen with both sides of the stethoscope. And I'm going to start at the right second intercostal space. Over to the left intercostal, second intercostal. Third intercostal, Erb's point. Fourth, so the tricuspid. And then down to the 5th, the mitral. Okay, and now I'm going to listen with my bell. Okay, that sounded really good. With the heart, I'm listening for an S1 and S2 sound, and that's what I heard. I didn't hear any murmurs or gallops or anything that would make me be concerned with the rate and rhythm of your heart.
Okay.
Okay? Next I am going to auscultate your lungs. Okay? And we start high above the clavicle here. Let's see. And I'm going to listen and compare on each side. When I put my stethoscope on, if you could take a deep breath in and out, that would be great. Let me know if you get short of breath.
Okay.
Okay, now I'm going to listen to your posterior lungs. I'm going to start about the same area. Down to the bases of the lungs where you may expect to hear crackles if the patient should have some fluid overload. Okay, I didn't hear any wheezes or crackles or any abnormal breath sounds. Your lungs sounded clear throughout all fields. That's what we like to hear. Have you had any trouble with cough or shortness of breath or anything like that? No. Okay, good. And I'm going to percuss, let's see, percuss the lungs just posteriorly. And I do know that you hear that sound of resonance. A dull sound, you might be worried about a mass or a tumor or something like that. And for people with COPD who retain a lot of air in their lungs, you might hear that more of a high-pitched sound. Next, I would like to listen to your abdomen, if that's okay.
Yeah.
I'm going to listen to all 4 quadrants in 15 seconds at a minimum in each quadrant. And I listened to all 4 quadrants for 15 seconds and counted the number of vowel sounds or tinkering. And yours was 5, which is normal.
Okay.
So, let's see. Oh, I did forget to palpate the abdomen. So I'm going to feel for just kind of moving my hands in a circular motion, and I'm doing light palpation, feeling for any masses, abnormalities. I would also assess the skin, make sure, you know, it's the, you know, pink, the color, the trigger, those kind of things. You do not have any pain in your abdomen?
No.
Nausea, vomiting?
No.
Constipation or diarrhea? No. Okay, great. Next, I'd like to check your pulses. I'll start with the radial pulse in the wrist and work up to the brachial in the elbow here. And I'm just testing for symmetry, if they're equal, if they're full. You don't want to have bounding pulses. That can be a sign of fluid overload and things, but you do want to have strong pulses. And you do have equal and strong pulses. Checking again, like I said, the brachial, and they are equal and strong. Femoral in that kind of groin area. Popliteal behind the knee. Work our way down to the feet, the dorsalis pedis, between that kind of that great tone, the second there on top. And sometimes if you can't feel these, you have to get the Doppler. And then checking the posterior tibialis back behind there on the side. Yep. Any numbness, tingling in the lower extremities of
No.
feet, legs? Any swelling of your ankles?
Sometimes after I get off work, my feet might be swollen.
Okay, okay. So I know it sounds counterproductive, but actually drinking water, lots of water, can help with that.
Okay.
And try and elevate your feet after work.
Okay.
That'd be great. I think the only other thing I need to do is check for pulse deficit. I will listen to your aortic pulse while checking the radial. The pulses are congruent, they go together, and that's what you're looking for. You know, one thing I do think I missed with you when I checked your aortic pulse, I should listen for 1 full minute.
Okay.
And to be sure that I'm not missing any murmurs or irregular rate and rhythm, those kind of things.
Okay.
Other than that, did you have any questions for me?
I don't think so at this time.
Okay, well, thank you.
Thank you.